Attention ladies! Welcome to Nourish and Thrive, your go-to channel for empowering health content. Today we are delving into a topic that could potentially save lives: the warning signs of ovarian cancer. This silent killer can strike any woman, but being aware of its early symptoms is our best defense. In this video, we will explore the subtle yet crucial signs to watch out for and the important risk factors that can't be ignored. Don't forget to subscribe and hit the notification bell to stay informed on all things wellness. Let's get started in our journey to awareness and empowerment. Did you know that currently there are no reliable screening tests available for ovarian cancer? This form of cancer is the fifth leading cause of death among women, presenting a significant public health concern. Tragically, only 20% of ovarian cancers are detected at an early age, resulting in low survival rates for those found later. But there's hope. When ovarian cancer is caught early, the survival rate soars to an impressive 94%, offering a much greater chance of surpassing the 5-year mark after diagnosis. While researchers are actively working on better screening methods, it is essential to be vigilant about the symptoms. Ovarian cancer primarily affects women and can originate in the ovaries, fallopian tubes, or peritoneum. These parts play a crucial role in a woman's system, producing hormones and eggs for reproduction. Let's dive into the symptoms of ovarian cancer as detailed by the Centers for Disease Control and Prevention. Number 1. Pelvic pain. Have you ever dismissed pelvic pain as just cramps during your period? While cramps are common, they could also be indicative of something more serious, like ovarian cancer. It is not only cramps. Discomfort in your abdomen, hips, or lower back might also signal ovarian cancer. As ovarian tumors grow, they can irritate pelvic tissues, leading some women to mistake the discomfort for period pain or digestive issues. If you have been attributing abdominal pain to your diet for a while, it is crucial to consider the possibility of something more serious. Number 2. Abdominal bloating. Abdominal bloating, a common complaint among women, can also serve as a warning sign of ovarian cancer. Often, women may attribute the bloating to factors like age, fluid retention, or an unhealthy diet, overlooking the possibility of a more serious underlying condition. However, ovarian cancer can lead to bloating ranging from mild to severe, and in some cases, the bloating might become so noticeable that it feels like excess weight gain. Tumor growth or fluid retention in the abdomen can contribute to the expansion of the waistline. Number 3. Vaginal bleeding not related to menstruation. If you're past menopause and notice vaginal bleeding or abnormal discharge unrelated to menstruation, it might be a symptom of ovarian cancer. However, it is essential to note that other conditions can also cause such bleeding, and it is not exclusive to ovarian cancer. In a study, nearly 20% of women with early-stage ovarian cancer reported experiencing vaginal bleeding. Number 4. Frequent urination. Frequent urination can be another indication of ovarian cancer. The close proximity of the bladder and ovaries can result in urinary disturbances in women with ovarian cancer, leading to increased urges to urinate, burning pain during urination, bladder spasms, or difficulty emptying the bladder. According to a study, about 2.5% of women with ovarian cancer reported experiencing urinary urgency, and it accounted for 16% of the women seeking care in primary care clinics. Number 5. Appetite changes. Changes in appetite can serve as early signs of ovarian cancer. Feeling full after a small meal or experiencing difficulty eating even a tiny amount of food might be indicative of this gynecological cancer. Ghrelin, a hormone produced in the stomach, plays a key role in stimulating appetite. High levels of ghrelin signal the brain to increase hunger, while low levels can suppress appetite. In a study involving women with gynecological cancer, low ghrelin levels were observed before surgery, potentially contributing to changes in their appetite. After surgery, ghrelin levels increased, yet the women did not feel hungrier, indicating the body's attempt to prevent weight loss and malnutrition as a survival mechanism. Monitoring changes in ghrelin levels could offer insight into the early detection of ovarian cancer. Remember, ovarian cancer might not always be a silent disease, with no noticeable symptoms until it reaches an advanced stage. Doctors consider it a possibility if symptoms like changes in appetite occur more than 12 times a month and are recent developments. It is essential to be aware of factors that can increase a woman's risk for ovarian cancer. A family history of ovarian cancer, gene mutations, prior breast cancer diagnosis, being middle-aged or older, and a history of uterine or colorectal cancer can elevate the risk. Other risk factors include Eastern European or Ashkenazi Jewish background, never giving birth, difficulties with pregnancy, and endometriosis. Additionally, factors such as being overweight, using hormone replacement therapy after menopause, smoking, having a first child after 35, or never carrying a pregnancy to term can also increase the risk of ovarian cancer. Fertility treatments like in vitro fertilization or IVF may raise the chances of developing a specific type of ovarian tumor. Staying informed about these risks can help women take proactive steps in their health journey. So, how can you take steps to lower the risk of ovarian cancer? If you're considering using birth control pills, you'll be glad to know that they offer more than just preventing pregnancy. Studies indicate that taking oral contraceptives for a year or longer can significantly decrease the chances of developing specific types of ovarian cancer by a remarkable 50%. The protective benefits can even last for a decade or more, making birth control pills a fantastic choice for many women in their fight against cancer. However, it is essential to be aware that while birth control pills can reduce ovarian cancer risk, they may increase the risk of breast cancer. Reducing your risk does not guarantee complete prevention, and discussions with your doctor about your concerns are always recommended. Certain surgeries can also influence your risk of ovarian cancer. For instance, a tubectomy that blocks the fallopian tubes, or a hysterectomy that removes all or part of the uterus may lower the risk of ovarian cancer by about 26 to 30%. This protective effect can last for at least 10 years after the surgeries. While it is not the only way to reduce the risk, it is encouraging news for women who have undergone these procedures. Having more children and breastfeeding can also decrease the risk of ovarian cancer. The risk reduces by approximately 10% for every 5-year increase in age at first childbirth, and women who breastfeed experience a 30% reduced risk compared to those who do not breastfeed. The longer the duration of breastfeeding, the stronger the protective effect against ovarian cancer. So, if possible, consider breastfeeding for an extended period to reap the benefits. It is crucial to stay informed about these factors to make informed decisions about your health and well-being. As the saying goes, prevention is better than cure. And if you are concerned about your risk of ovarian cancer, it is crucial to discuss it with your doctor. They can offer personalized advice on lowering your risk, as different strategies suit different individuals. However, even if you take measures to reduce your risk, it is essential to remember that no one is invincible. When it comes to diagnosing ovarian cancer, there isn't a specific test, but 2 options can aid in diagnosis and monitoring for women with symptoms at high risk. The first is transvaginal ultrasound, which uses a probe inserted into the vagina to create images of the ovaries and surrounding structures, helping to detect masses or tumors. The second is a CA-125 blood test, which measures CA-125 protein levels in the blood, indicating ovarian cancer or other conditions. While neither test can definitively diagnose ovarian cancer, they can assist in conjunction with other diagnostic tests, such as a biopsy, to make a diagnosis. Treatment for ovarian cancer typically involves surgery and chemotherapy, with a gynecologic oncologist specializing in female reproductive system cancers guiding the process. Surgery can remove cancerous tissue, and chemotherapy uses medication to shrink or kill cancer cells. It is crucial to develop a personalized treatment plan with your doctor. Thank you for joining us today as we explore the warning signs of ovarian cancer and how you can take steps to reduce your risk. Remember, early detection is crucial, and if you experience any symptoms or have concerns, don't hesitate to reach out to your doctor. At Nourish and Thrive, we are passionate about promoting health and wellness, So be sure to subscribe to our channel for more informative content to help you live your best life. Stay informed, take care of yourself, and together, let's nourish and thrive. See you in the next video.